Good evening, everyone. I want to welcome you to the Central Valley and Sacramento Safe Schools for All School Health Panel. We're very excited that you've joined us this evening and we look forward to a great dialogue. I am your moderator, Kimberly Brown, and I work with Safe Schools for All on the awareness campaign. Tonight's panel is targeted to African American and multicultural parents in the Central Valley and Sacramento areas. Our goal is to provide you with critical updates and information regarding your students safely returning to in-person learning this upcoming school year. We have a panel of great representation across the board. We have a Safe Schools for All representative, a regional educational representative, a renowned California medical expert, and we have community educational advocates. And they will all share with you briefly, and then we will open the floor to Q&A. Before we do that, I just want to quickly go over the agenda. We're going to have welcome and introductions, general instructions, as well as the agenda, and then we'll get to the speakers' comments, and then we will get to the Q&A. So very quickly, the agenda is clear. So I'll move on to general instructions. Tonight, the way that you'll be able to ask questions will be through the Q&A function at the bottom of your screen. Drop your questions in there and we will address them to the panelists. If you have a particular question to a particular panelist, be sure to include that. Otherwise, we'll open it up to the floor to anyone to respond. You can also submit your comments during this panel via the Q&A, and we'll share them. We know that tonight, some people have questions, some people have comments. Everyone just wants to be heard, and we want to respect that. As always with this virtual world, if you're having any issues with connectivity during the call, we suggest that you end and then try to rejoin the call, and hopefully that will alleviate your issue. So I'm very happy to quickly just announce or introduce our panelists. Again, they will all address you individually. We have Dr. Naomi Bardock, who is the Safe Schools for All team lead. We have Manuel Escondón, who is Fresno County's Director of Student Equity and Empowerment. We have Dr. Jerry Abraham, who is the Director of Kedron Vaccines at Kedron Community Health Center. We have Barry Axis, CEO of Voice of the Youth, a community organization, as well as Mike Espinoza, who is the Director of the Children's Movement of Fresno. With that said, we want to jump right in and let Dr. Naomi Bardock kick us off. I'm going to stop sharing my screen and pull her slides up if you give me one moment. Perfect, here we go. And Dr. Bardock, I will turn the floor over to you.
Thank you so much, Kimberly. And thank you for inviting me to and organizing these town halls, really school health panels, really, really helpful. So next slide. I want to tell you guys about the Safe Schools for All initiative, which I'm leading. It's this initiative from the state, started in December 2020. And the sort of goals and the things that we're doing the Safe Schools team is we look at the science that we have here, the science that we've had from around the world, and we have that science and the best practices and evidence lead the way for us to understand how to have safe and successful schools in California. The initiative continues to support safe schools with very tangible resources. So this framework talks about funding to support safe schools, hand-on assistance, because we know that the dollars are important, but we also need to make sure that people understand how to use those dollars. It's complicated to do safe schools in the pandemic. Also very tangible safety measures for classrooms, including mask, being able to provide masks for folks, being able to provide testing materials and testing access, And then finally, transparency and accountability, which includes, it's important, really important to build the public trust and accountability. We provide on our website, the school hub, which you'll see, I think we give you a link at the end of this slide deck. There's interactive maps on the school's hub. It's showing the school instructional status, also how many dollars are going to the schools and the school districts, and also information about outbreaks, any cases that are happening on the school grounds. Schools need to post their COVID safety plan as part of the transparency. And we're providing things in a way that really focuses on equity as a really important piece of what we do in the Safe Schools initiative, making sure that we know that different schools need different things, and some schools need a lot of support that some schools before the pandemic didn't have all the resources they would need. We need to make sure those schools can be as successful as every school in California. And the last piece is that there's both state and local partnership together, focusing on these core pieces of how to make schools safe: vaccines, testing, masking, ventilation. There's funding that actually supports these collaborations, the on the ground support that goes to schools. Next slide, please. So there's been a huge investment in California's children and their safety in our K-12 schools. Over $25 billion in state and federal funds for the California schools to get back to full in-person instruction. So some examples of how that funding can be used include the masking, ventilation, COVID-19 testing, cleaning, extra instruction to make up for the learning loss, as well as social, emotional, and mental health services. So those dollars can go to a lot of things: safe schools, but also successful schools to support our students and educators. And there's that, as I mentioned, that strong Safe Schools network of county education and health departments are also supported by some dollars. Next slide. So what is the public health science? What do we sort of know? We have learned so much since the beginning of the pandemic about how to do safe schools, and the research shows that schools can reopen safely and stay open. So we've learned some surprising things. First of all, as everybody knows, parents, teachers, all of us know that kids, they're kind of germy. They pass things around. We first thought, you remember in the very beginning of this pandemic, we thought children would spread the virus like they normally do with every other cough and cold. And so we shut down schools. That was the reason why we did that back then. But it turns out that COVID does not act the same way all those other coughs and colds act. Kids get COVID less often and are less ill than adults, and are less likely to pass it on than adults are. The other thing is that children actually, throughout the pandemic, whether schools are open or schools are closed, they're most likely to get COVID from actually another adult at home. And that's just because home, nobody's wearing a mask at home, it's very close, it's intimate, and adults are just better at passing on COVID than kids are. So they get it usually at home, not from being in school. And then finally, studies from around the world, in the US, in California, in China, in Chicago, showed that schools could operate safely when there were key safety measures in place. Even before the vaccine came out, we knew that there were safe things that we could do. Next slide. So what are we going to do? We know schools, school is really the best place for kids. What are we doing for the school year? What can we look towards for the school year? A priority for full in-person learning, supporting education, mental, emotional, and social development of children. Next slide. So how are we going to get there? The California Public Health guidance was released on July 12th. Last week. It was updated for 2021-22 school year, and it includes a layered approach that aligns with the CDC, the American Academy of Pediatrics, the national science, all focuses on a layered approach and these particular layers. So it's, again, like I said, it's informed by what we learned in 2020, 2021 last year. And we know that the powerful effect of vaccinations really cut way down on community transmission and case rates. They're a game changer. They're safe and effective, and they are everybody 12 and older is eligible for those vaccines. We also know that the masks, so those are a universal masking requirement. Masks are the simplest and most effective thing we know to prevent transmission. It's like very, very effective. They're required indoors. Outdoors, they're optional because outdoors is safer than indoors. But in that indoor classroom setting, they're required and they're a terrific safety layer, recommended by the CDC, recommended by the American Academy of Pediatrics. Ventilation. Ventilation is about airflow, air moving through. So you take out one set of air, you put in new clean air. Airflow in classrooms should be optimized as much as possible, make it as good as possible. CDPH, the guidance, has specific guidance for schools on how to do ventilation. And it just helps to move the clean air in. It makes the indoors more like the outdoors, which is the safer way. And then lastly, hand washing. It is always a good practice to do good hand washing. It helps prevent infections from spreading. And so it continues to be a recommended piece of what we're doing. Next slide. Another helpful layer is stay home when sick. We know that if you have symptoms of COVID, that you can pass it along, even mild symptoms. If you have COVID, even the mild symptoms, you can actually still pass it along. Some people have no COVID symptoms, but many do. And so the staying home when sick and getting tested is a great way to prevent passing along whatever is making you sick to someone else. We're all in this together. And so staying home when sick is good practice before or after COVID, but particularly with COVID. Testing, COVID-19 testing can detect the virus even before your child or other students or teachers even start to feel sick. So schools that do regular testing with their unvaccinated students and teachers can help everyone stay safe in school. There's $1 billion specifically for school-based testing from the federal government for California. And California has one of the strongest actually programs for school testing in the nation. The other idea, and because of all those dollars, it's free testing for everybody in the schools, especially for people who are unvaccinated. Contact tracing means that your child's school or local health department will notify parents and teachers who had close contact with someone on campus who tested positive for COVID-19. That's a way of keeping everybody safe. And the people who do contact tracing are just there to help. They're there to help people out, figure out what's going on. And then finally, the transparency piece. I spoke a little bit about that earlier. It means that your school should have good information easily available to you about the safety plan. Everybody is required to have a safety plan and posted, and is supposed to have it posted on the website. And then ideally we'll disseminate it to families so that you have more information so you can feel safe about what your school is doing. Next slide. I want to touch on Delta variant because it's such a big topic right now, and we're thinking so much about it. We are paying very close attention to it because, as everybody is, it's something that's worrisome. We just want to make sure that we understand what's going on. We still have key tools that we know are still going to help schools stay safe and successful. So the Delta variant is more contagious. What we are seeing is that the patients who are hospitalized, the people who are hospitalized with Delta, are people who are unvaccinated. It just highlights again how important those vaccines are. They're very effective, including against the Delta variant. 2 doses of the vaccine, very, very effective against the Delta variant. And they help stop the spread. It really helps to be fully vaccinated, those 2 doses. And then, of course, with the Delta variant, keep wearing those masks, and those layers are really, really helpful. Next slide. So this is a picture to help bring home what are the key layers for safe schools. Vaccines, vaccines, vaccines. Layered approach. Lots of vaccines helps keep everybody safe, and particularly helps create a wraparound layer that's like a protective layer around the schools. Masking, very effective. Ventilation, testing, stay home when sick. Next slide. So this is the schools hub. So for more information on the COVID-19 and schools, you can go to the schools hub. You can see that there's actually a very specific parent page on that one half of the schools hub on that right-hand part of the page. It's both in English and in Spanish. Particularly, I think it's really helpful just to end on this idea of what can parents do. So I'm a pediatrician. I like to give parents tools so that they can also have a sense of things that they can do that help support their child and help support students in school. So you can know what your school safety plan is. So that is one piece to empower you to understand what the safety plan is, getting yourself vaccinated, other people vaccinated. If you have eligible kids, get vaccinated. We talked about that protective layer. Helping your kids understand about masking is actually really helpful. Anticipate that they'll be wearing a mask in school. The masks keep them safe in school, so reassuring them about that. And then testing, if your school is doing a testing regimen to help keep things safe, participating in that and helping be part of that effort to keep the school safe. So I encourage everybody to go to this Parent Hub to learn more about that. And I think that's it for my presentation. Thanks so much. I'm happy to take questions later on during the question and answer period. Or we can do it now, actually. Kimberly, I'm not sure which one we're doing.
We're going to go through everyone's, let all the
Perfect.
panelists, and then we'll address the Q&A. Again, thank you, Dr. Bardock. Very thorough. If there are any questions, please drop them in the Q&A, and we'll be sure to address them as, when all of the panelists have spoken and introduced themselves. Next, we'll move on to Manuel Escondon, Fresno County Director of Student Equity and Empowerment.
Okay, so good evening, everyone, and happy new school year. So I know a lot of you like Christmas and you like Thanksgiving and Halloween and 4th of July. My favorite day of the year is the first day of school. Been doing this for 30 years, you know, high school vice principal, middle school principal, you name it, I've done it. Been doing it for 30 years. So again, happy new school year. Okay, parents. So not only am I school administrator, school educator, all that good stuff, but I'm a parent of 4 kids. So I had my gloves on going toe to toe for Wi-Fi the last 18 months. So I could feel where you're at. But as a parent, as an educator, you know, I've seen this with kids, my kids and other kids. School is a place to be. You know, sometimes as adults, we're like, oh God, I got to get my kid to school and I got to fight that morning bus traffic, dropping off. But for kids, that's where they want to be. That's where they have fun. That's where their friends are. And as much as they complain about the food, you know what? They're breaking bread with 200 or 300 kids. So they're loving it. So it's important. And when you talk to your school districts, or when you talk to your school teacher or school principal, have them put that school safety plan like on the first page. When you go to ABC Elementary, the first page is right there. And encourage the principal saying, look, yeah, I got the 40-page school plan. Give me the 1-page Reader's Digest. I know I'm dating myself with Reader's Digest, but what are the key facts? For instance, if we go into lockdown, what happens? Are we going to scramble like we did last time? Like, oh my God, hotspots, where are they at? No, the hotspots are right here. I had this situation last spring. A kid had Kleenex. Oh my gosh, the kid has Kleenex. Wow. And again, the school handled it the wrong way. I came in, I said, look, it is allergy season in the Central Valley, so kids will carry Kleenex. But be clear on what's acceptable, not what's not acceptable. And if a student is sent home for 10 to 14 days of quarantine, we don't want to break in learning. We want that work to come with them. So make sure, you know, you and the teacher are communicating clearly in the event that happens. If you don't agree with what the teacher may share with you, don't hesitate to go over their head. There's so many times parents will tell me, oh, Manuel, you know, if I go over the teacher's head, then it's just going to be horrible. I'm going to say, look, it's already pretty bad. So go over the teacher's head because we want to make sure that teacher is providing an amazing experience. You notice when I came in, I'm blowing my horn. I love education. I want you to encourage all of your kids, teachers saying, hey, I want you to be exciting. I want you to be entertaining. I want you to be engaging. I want my kids to wake up every morning saying, I got to go to Mrs. Brown's class. I got to go to Miss Jessica Pernoz's class. So help them and coach them saying, make the learning exciting, because what we don't want is where, and some great teachers sometimes do this. Okay, open the book, read the chapter, answer the questions, turn in the report at the end. Come on, there's other ways, right? Or I ran into a situation last year. Well, Mr. Escandon, we read the book and we watch the movie and then we compare. There's so many other ways and exciting ways to engage kids. So really encourage your teachers to engage your kids, provide that rigor, and not write your spelling words 100 times, where, you know what, let's write our spelling words 20 times, and let's write our spelling words in a sentence 1 time. So there's a lot of ways to be engaging. Make sure you talk to your teachers to be engaging. The other biggie, and especially for my young men, I don't need anything. I'm too cool for school and I got this. Well, you've been home for 18 months. We're all a little bit stressed. So the questions you're asking is, what are the social emotional resources that are available? Where are they and when are they? Because sometimes like, oh yeah, we have them. Where are they at? Well, I don't know. There's a wait list. No. Let's get from the first day of school or even before school starts, talk to your school site principal or go to that parent meeting and say social emotional resources. What are they? Where are they? And when are they? Parents are going to get mad at me right now, but that's okay because I'm going to push you and I expect you to push me back. You know, NFL training season has started. Not training season, yeah, training season. So, so really our kids, we got to get them sleeping 8 to 10 hours. What? I've been sleeping 4 to 5 hours and I'm doing just fine. No. School starting, school hours, so that for them to be at their best, we need 8 to 10 hours. And they're going to nudge you the first couple of nights like, Mom, you're crazy. Dad, you're crazy. No, I'm crazy in love with you. That's why I need you to sleep 8 to 10 hours. The social media, we already know that people, the more time I spend on social media, the more likely I am to be depressed. Why? Because I'm comparing my life to everyone's highlight reel. Work with your kids, talk to your kids saying, look, that's a highlight reel. We got 154 people on this Zoom. There's 154 of us who have issues. So let's find that trusted loved one to talk to work through. But yes, definitely 8 to 10 hours of sleep. And for some of us, that's me, we got to collect all the devices because if not, they stay up all night and then you can't talk to them in the morning. And most important, you know, let's make this fun. Sometimes I'll hear parents, oh, Mr. Escandon, I can't wait for school to start. I'm ready to send all my kids to school. You know, what does a kid think when he hears that? Oh, my mom doesn't love me. My dad doesn't love me. They're just trying to get me out of the house. So instead of saying, I can't wait for school to start to send these kids to school, it's more like, oh, I just can't wait for school to start so my child can go interact with all his amazing buddies and friends. So again, be careful with the messaging and marketing that we're exposing our kids to. And again, have a great school year. Continue to participate in all those meetings, whether it's school site council, parent PTA, PTO, whatever. Stay involved so when things happen, you're in the know. And I'm big on, you know, if there's communication, there's relationships, and there's positive systems. If there's not some of that, then we run into issues. Again, thank you. Good evening. My time is up. I'm looking forward to the Q&A period. Who's next?
Thank you, Manuel. Thank you for that. Appreciate it. Next, we have Dr. Jerry Abraham, Director of Kedron Vaccines at Kedron Community Health Center. I'll just put a little introduction of my own. He's worked very closely with me on Vaccinate All 58, on my youth 12 through 15, a lot of the state COVID awareness campaigns. And I consider him my own, very own Dr. Fauci. And he can go on, but I know he's just gonna provide us with some great information right now. So Dr. Abraham.
Yeah, absolutely. Thank you so much, Kimberly. Hello, good evening, greetings, everyone. My name is Dr. Jerry Abraham. I am the Director of Kedron Vaccines here in South Los Angeles, where we have vaccinated some 300,000 people. Our story definitely goes back to December when vaccines became available, when Pfizer obtained emergency use authorization in this country. We had seen vaccines landing in different parts of town, different parts of the country. And we were, of course, very concerned they weren't necessarily getting to our communities, communities of color, to where Black and brown people live. And so we definitely made that our quest to get vaccines to those arms that needed them most, those infected, those dying from COVID-19. And that's how now we have now vaccinated over 300,000 people in South Los Angeles. And we continue that mission. And so we're very excited to be able to talk to you as Dr. Naomi, as School Administrator Manuel just mentioned, as many of us are talking about the power of vaccines, the power of being safe. When we're safe, we're able to go back to life, back to work, back to school, back to church, back to playing sports, back to all the fun things, the movies, loving our loved ones, hugging and kissing on grandma. No one wants to accidentally send a loved one to school, our child, and then have them either expose another student or a teacher, and then that teacher have to stay home or get sick, or that student go home and take it to an unvaccinated loved one who has medical conditions or is aging. And so it's so important that we definitely, when we are eligible, when they are available, that we get vaccinated, not only to protect yourself, but to protect your household, your loved ones, your classmates, your coworkers. And ultimately, this is about doing this so that we can protect our community and so that we can thrive and we can move forward. As you know, it's been unrelenting. It's been a very difficult 15 to 20 months. We know this has been challenging for learners, for pupils, for your students. It's hard to be an elementary school student studying and learning from home. We know that's hard on parents. So we're really looking forward to do everything. We know this is the right thing for the state to do, for us to get back into the classroom, get back into schools. But as everything that was mentioned, we want to do that as safely and as effectively so that no one does get sick, that we definitely contain any infections or prevent any epidemics or hotspots within our communities. And we just want to make sure that we don't have to dial back. The power of these vaccines and the power of the light at the end of the tunnel is that we're going to be able to do all the things that we love to do, including going back to work, back to school. But if these numbers go up, which we're seeing with Delta, and who knows what potential variants may come down the road, and if the efficacy, for example, the protection is not there always for some of these new variants, we may have to have more safety measures. And so we really don't want to do, and the best tool that we have for not having to go back to those dark ages of social isolation, working and going to school from home, is really to make sure that we're playing our part. So number one, definitely get vaccinated. Two, definitely wear masks in school settings. Be mindful when you're around large crowds, especially when vaccine status is unknown. Of course, ask that on public transportation you wear masks. Of course, this is not easy for children to do. I have nieces and nephews, and hand hygiene is something we constantly have to remind them. So let's continue hand hygiene practices. And then, of course, every local health jurisdiction has their recommendation. The state has their guidance. The CDC has their recommendations. So when it comes to social distancing and other measures, including keeping our schools clean and ventilated, every one of those may look a little different, but in general are all important parts of the strategy. Number one, of course, being let's get vaccinated. Now, having vaccinated some 300,000 people in our community, we have heard it all. I've seen some questions already, and we are definitely looking forward to answering a lot of your questions. Pfizer obtained emergency use authorization from the Food and Drug Administration for individuals that are 12 years old and older. We're not ready yet to vaccinate people under 12 for COVID-19. However, we anticipate potentially emergency use authorization as early as late September or October. So then at that point, we will be able to potentially vaccinate our elementary school age children against COVID-19. And we do look forward to that. We do think that the more people in this community that can be vaccinated, the faster we achieve that herd immunity, that community immunity, so that we can truly end this pandemic and get on with our lives. Other things to look forward to and other concerns, as Dr. Naomi had mentioned, we too, as family physicians, as community physicians, we're talking to a lot of parents, to a lot of loved ones. We want to assure people they followed a rigorous clinical trials process, although accelerated, to make sure that these vaccines are safe and effective. And thankfully, because of the taxpayers of this country, they are free as well. So free, effective, and safe. And so we get a lot of questions about puberty and development, about do these affect fertility? How will they affect my child? So I really want you to hear loud and clear, having vaccinated countless people, over 300,000, no one has needed an EpiPen here. We have not sent anyone to the hospital. And we look at the hundreds of millions across the country vaccinated, and then there's been 3 billion doses globally. No one, there have been very few cases of adverse events, and we're watching and monitoring those things very closely. So I think that assurance is very important for people to hear. These are not experiments. These are life-saving essential medicines that help us live our best lives, our longest lives, our highest quality lives, our happiest lives. And that's all that we're trying to do here in medicine and public health, specifically when it comes to vaccines. I will also plug testing briefly. Continue following your testing guidance in your communities. Testing continues to play an important role, especially as we're monitoring breakthrough cases of people that are vaccinated who are getting mild cough and cold or asymptomatic COVID-19 infections. We want to contain that. And as Dr. Naomi mentioned, please do stay home when you are sick. Please do follow those quarantining recommendations. That's really how we make sure transmission, passing this along to others, doesn't occur. And that's really ultimately with a communicable disease, a disease that can pass from person to person, ultimately helping end the spread of that virus is number one. So do continue to do all that. We look forward to answering any of your questions. We hope you get vaccinated. We look forward to seeing you all go back to school, all go on to graduate, all go on to doing all those things you want to do, all your dreams come true. And these vaccines will help you do that. Thank you.
Thank you, Dr. Abraham, always. Next, we're going to hear from Barry Axis, CEO of Voice of the Youth, a community organization. Barry?
Yes, Barry Axius. Voice of the Youth, I'm not really going to, tap in too much about safety. Vaccinated, I think myself, it should be choice. And I think that there's a lot more research that needs to be done. And I think that a lot of individuals are pushing towards vaccination and making it seem that there's not other sides of questions that we should have. So I'm not going to discuss that component of you should get your kid vaccinated and things of that nature. All respects to the doctors and definitely all the healthcare workers in the front line and everyone else that has gone through, a lot of shifting. But I will talk about the psychological and emotional, trials and tribulations of our young people being without any kind of structure. And some of that is school. Though I do honestly believe that not being in school for so long has given parents as well as teachers and students a newfound understanding of how unique their relationship is, as well as, I think, for me, a renewed show of respect, where the first parts of social distance learning, my organization, Voice of the Youth, started a tutoring program out of the necessity that we had so many young people who was involved in social distance learning that were falling way behind, with a good some majority of our young kids striving because they didn't have more of the micro management teaching style over them and not the distractions of their friends in classrooms. Some of them actually propelled and got the best grade point average that they could ever imagine. But some of our young people truly struggle because a lot of our young people need that social engagement, need that physical interaction, need that structure. Unfortunately, a lot of our homes, a lot of the school kids that we deal with in and out of school, there's not structure in their neighborhoods and they're not structure in their households. Some of parents, to be honest with you, just started realizing they had kids, because so much of parenting nowadays is literally from work, go to sleep, back to work, and really dealing with their child for about maybe 1 to 2 hours. So that nuance of understanding and realizing your child is a lot different than just a pickup and a wake up. Um, for the children realizing how much stress that parents really have, I think that it was really eye opening. For some cases, I think that it um, caused some turbulence, but as things got more normalized to being at home, I think some folks found a way through. But unfortunately, with the rise and uptake of violence, not only here in Sacramento, but throughout the country, we've seen that we have a lot of young people that really honestly need that school structure. And it's not just because they're learning, but just the mechanism of the social engagement with other students that they may not be engaged with because they're not in their communities or not in their neighborhoods. Activities that have kept them off the streets. So I really look at opening of schools, the safety of our children psychologically is at the height of it. I think there'll be a new intent to learn, a newfound respect for teachers, faculty, as well as students. But I also want to challenge all school systems where we still have the same amount of problems that we've had before the pandemic hit our communities, that they engage more and allow more community-led grassroots organizations like myself, Voice of the Youth, that I have a program with John Bildwell that I've been really in partnership with them for the last 7 years, allow us to come to your schools and help advocate, as well as help promote more healthier and safer guidelines for our young people, create different palettes that we can utilize instead of using strict methods of restriction for our young people when they get back to school, because the transition of having some of these kids back to school when they've spent literally a year and a half or some more of non-structure, of really dealing with their teacher online, dealing with young people online, and when they dealt with some of their friends or some of their adversaries, it's been met with no regards to whoever's there, because as we know on the streets, a lot of things have happened. If folks have been paying attention to news, you have young people gathering in places like the Delta Shore. You have in Sacramento here in Old Sac, where you just had the shooting death of one young man, 16. Um, there's been major incidents that have happened. So our young people are going to be very hyped up. Some will be very ready to get back to that structure. Some will be fighting against that structure because they really realize that they don't really want the structure. But I think and I believe and I know that the structure that we can provide for our young people, that safety that we can provide for our young people at these schools is a necessary. And I'm hoping that more parents will now understand your involvement is key to change and key to decision making, or decisions will be made for you. And sometimes those decisions that are made for you aren't going to be to your best benefit. So I'm hoping that there'll be more student parents engagement. I'm hoping that there'll be more teachers more open. I love the energy from one of our teachers. That's the kind of energy that we want to see when welcoming the students back, understanding that this is going to definitely be, though this should be a normal, this is definitely going to be a um, new regime of dealing and going forth and what school looks like for being away from it for so long. There'll be many challenges, and I hope those challenges are met with not a heavy hammer, but with soft gloves, knowing that our young people have gone through so many traumatic changes and some turmoil, and a lot of who they could have turned to are at these schools. So that reuniting in a way, I think will create more positivity. But I again encourage for us to have more safety measures psychologically, mentally, physically, emotionally for our young people, but reaching out to those grassroots organizations that can do that kind of work that they're trained to do, um, that they've practiced doing, and that they can support the young people when moving forward into this new school year, and not having our kids feel fearful about entering the school year, and having those kids continue to elevate and get to the next level.
Thank you, Barry. Especially because this is a panel that's targeted to African American and multicultural students. We have to understand those nuances of our community, of our kids. And I really thank you for bringing that. And I really thank you for bringing that connection to our community organizations. And that's why one of the, when we were putting together these panels, we understood the importance of including community organizations who have been an important part with our youth in our community during this time off. So I appreciate your words, Barry, and thank you for joining us.
Thank you.
We're going to move lastly to Mike Espinoza, who's the Director of Children's Movement of Fresno. I see questions in there, so we have plenty of questions to get started. And as soon as Mike shares his part with us, we will jump right into the questions. Mike?
Yes, good afternoon. Thank you, Kimberly. Good afternoon, everybody. I see that there are some really fantastic questions in the queue. It looks like they are directed heavily towards our healthcare provider, healthcare experts, and our school officials. So I won't take up too much of the airtime so that we can start answering some of these questions. But I got to really throw some appreciation at the rest of the panelists, as well as all of you for being on this webinar this evening, because this is such an important issue. And I guess one of the reasons I imagine I was asked to be on this panel is that my work in Fresno with the children's movement has really taken shape. Like most of you all, my life and my work was all transformed when this pandemic occurred. By training, I've been a community organizer for the past 20 years, and working in Fresno, right off the bat, the real questions that people were asking. I mean, before we started turning to our educational and healthcare experts, we started turning to each other to say, gosh, what are we going to do? How are we going to manage? What are our needs? Gosh, how are we going to, meet our basic needs? And I guess part of what I've learned working on large-scale community engagement projects like the COVID Equity Project that took root, which is a major partnership between community-based organizations and the Department of Public Health here in Fresno County, was that right off the bat, we were, in addition to really engaging and going door to door, knocking on doors all over Fresno County, was that the needs were really at the basic level of how am I going to pay my rent? How am I going to go back to work? How am I going to put food on the table now if I lost my job or don't have money coming in? How do I meet those basic needs? As the pandemic progressed and into the school year, we saw a different set of needs where folks were like, gosh, I have a third grader and I don't speak English, and they've got this device that I've never used before. How do I manage that? And so part of the community engagement work has been really about understanding what those needs are. I gotta say, what I've been really moved by, and listening to Barry kind of lift this up as well, is that in the hierarchy of needs and concerns that residents and community members have raised up, first we get in the number 3 spot, we get, childcare. How do I manage? How do I have access to childcare? How do I get back to work? How do I manage, being in a work setting? The second being digital literacy. How do we're doing school online, and there is a chance that we could go back there. But the very top issue overwhelmingly has been mental health, has been them seeing their children struggle with being kept inside a box, literally, for the past year. And what we know is that there's been so many different solutions out there thrown out around mental health. How do we, reshape the mental, the healthcare billing system? Very, very big policy questions. At the end of the day, mental health healthy mental health supports really come down to having caring individuals and caring relationships with, in a child's position, with caring adults in their schools. So I gotta say, if there's one thing that's really got me fired up about this topic is that we are going to see the ripples and effects of this pandemic for a long time to come. But getting back to some level of having folks feel like and having our children feel like they're anchored into a healthy environment is getting them back into a very caring educational situation surrounded by caring adults who are paying attention to their issues. So I think part of what I'd like to encourage everybody listening to is that if we are, following the advice of our healthcare professionals, if we are following the guidance of our school leaders and school administrators about, navigating a process, just like what Manuel was talking about, there's plans. There are plans upon plans upon plans, but finding ways to have our children rejoin a community with their peers and with caring adults is going to be incredibly transformational for getting our kids the mental health supports that they need and getting us into a full recovery mode. So I won't take up much more of the airtime, but thank you for the opportunity to speak.
Thank you, Mike. I appreciate those words. I appreciate the work that you're doing there in Fresno. It's important work, and I appreciate your perspective. We're going to jump into a Q&A. I see that our panelists are engaging the Q&A and answering some questions, so that is great because we want to make sure that we address everything. I'm just going to throw a question out really quick, and I think this will probably be best for Dr. Abraham. With the Delta variant, how are kids under 12 going to be safe in school? It seems to be infecting younger children. All kids 6th grade and under won't have the vaccine.
Yeah, of course. And of course, Dr. Naomi will also, I'm sure, have very important recommendations here. And I know there were some other questions that are tied to this. So just know when we say recommendations, yes, we're getting information from experts, including physicians and scientists from the federal level at the Centers for Disease Control and Prevention and the National Institutes of Health. Then here within the state, the California Department of Public Health are making those recommendations as well and looking at more of our local and state context. And then of course, ultimately our counties and our local health jurisdictions are making recommendations. So we will continue to monitor closely where we are with the Delta variant. We are truly in a 4th wave as we see numbers rise throughout the country. And those numbers are different in different communities, especially they are related to how many people are vaccinated in the community. So where there are large amounts of unvaccinated people, we are seeing the Delta variant spreading much more rapidly. So that's why I know there's a lot of concerns. Are we peddling vaccines? And that's not really what this is about. This really is about so that we can be safe and healthy. We don't want to see any young ones suffer or get COVID. We don't want to see anyone die from COVID in our communities. So I know that's difficult and these are difficult conversations. So I really want us to, as you know, Kimberly, we really try to meet people where they are. This isn't trying to coerce anyone. We're not trying to make you do anything. We totally understand that people are coming from that space of wanting to do the right thing, the best thing for their children and their families, and they are concerned about their children's health and safety and want to know that these vaccines are safe and actually going to work and protect them. So we do know that is true. And it is unfortunate that right now the COVID-19 vaccines are only available through emergency use authorization from the Food and Drug Administration for individuals 12 years and older. That means those of us that are eligible need to get vaccinated because there are many people in our community, including children under 12, who cannot get vaccinated and are vulnerable. Now, yes, COVID affects different people differently. That is true for older people. It is also true for children. So it's very hard to predict why some children have been more seriously impacted by this infection. It is hard to say why some children have had this multi-inflammatory systemic syndrome, MISC, and why some kids end up hospitalized. But we do know it happens, and some of the latest figures are that 12% of children are hospitalized because they are not having oxygen levels that are safe or they're having difficulty breathing. There are lots of reasons why people are having severity or needing certain interventions and treatments. And so that is a really hard place to be, especially when it could have been prevented. And that's what we're really trying to do here. We need to continue to use masks. We need to continue to be safe, wash our hands, stay home when we're sick. And it is going to be a moving target, and we're going to have to continue to partner with our school administrators, our principals, our teachers, because it's going to be very local conversations based on outbreaks, how many people have COVID in our community. And that is really what's going to drive all of us together, making sure that we do the right thing to keep our children as safe and as protected. And that's ultimately all we can do. We can't do anything more. There's no miracle cure or drug. We cannot snap our fingers and make this all go away. We cannot go back to just entirely closing everything back up. And we cannot pretend this isn't around and just open entirely and act like COVID-19 and the Delta variant isn't real. So it's going to be a combination of all of these things. And ultimately, this is an equation where we are just trying to reduce risk and exposure. And every decision we make, whether it's to go to that event or not wear a mask or get vaccinated, helps decrease that risk. And that's ultimately how we're going to end this pandemic. Thank you.
Thank you, Dr. Abraham. Dr. Bardock, there's a question you might be more fit to answer. With vaccines being a top recommendation to stop the spread, will the teachers and staff have a vaccine mandate, especially around unvaccinated children?
Definitely a hot topic. And there's no, first of all, just to clarify, which I think some people in the Q&A have noted, there's no, so the FDA has emergency use authorization, but not yet FDA approved. They're considering the vaccine right now. They're looking at all the data for approval. If it's not approved, it can't be like legally, there's no way to say like, oh, everybody has to, there's no mandate sort of possible until it's actually had that approval. So that's one piece. There are definitely schools, both private and public, and I just heard today actually about some school districts that are very much encouraging teachers to get vaccinated. And there's 2 school districts that I just heard about that are saying either the teacher has to be vaccinated or they do twice weekly testing. So it's a way of creating that protective layer, but there's no mandate right now for a vaccine for teachers, and that's beyond a public health piece, it's a legal piece. So just to sort of explain that there's 2 different pieces to that.
Thank you. We have a question from Antoinette, and I I really want to get to it because it's talking about Elk Grove. It says, our schools here in Elk Grove, there is no 6-foot requirement in class or cafeteria. And she's very concerned as a parent that the kids are so close in groups that they can touch each other at arm's length. She has an 8-year-old, and she's concerned that with this, along with the approval of parents being able to enter campuses with no masks, walking kids to class, etc., she also feels there's a need to be better janitorial sanitizing in the bathrooms during the school years. It's very unsanitized.
Mm-hmm.
And I think that's more of a comment that I just want to share from a parent who's actually there in Elk Grove, who's just expressing what she sees. If there was a question in there, Antoinette, that I missed, please be sure to get back in the Q&A, because I read that more of a concern that really needs to be shared.
Right, Kimberly, but on that concern,
yeah,
we want to make sure, okay, she has a concern. So what's that? Does she bring it up to the teacher? Does she bring it up to the school counselor, to the principal? She goes all the way to the top to the superintendent and then on to the school board, because we don't want our parents just saying, well, you know what, I don't do that because they don't listen to me. No, 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 no. You're going to start doing that, and we're going to put it in. I use email. That way there's documentation. And if you have a few other parents that have the same concerns, because if Manuel Escandon brings it up, oh, that's Manuel Escandon, you know how he is. But if Manuel and Jerry and Barry and Kimberly and Kimberly and Kimberly, there's a lot of Kimberlys on my screen. If we all bring it up, they're like, hey, I think we should address that issue. Absolutely. So with all of us, again, it's a local decision. We have all these different districts. So some districts will say, okay, we listen to our Department of Public Health, but here's what we're going to do. But you know, if we have a vocal parent group, they're going to say, now, wait a minute, let's bring them into the planning session. So it's real important that you don't stay quiet and don't get frustrated, because if you get frustrated, nothing changes. Please follow that policy and protocol all the way to the superintendent and on to the school board if necessary.
Thank you. I think there's another question that I'm sorry, please.
I wanted to encourage the same thing. I think part of the message for this town hall is empowerment. So empowering people that they should know where to look for that safety plan and be able to feel like they can raise their voice. I will say that parents coming on, visitors coming onto campus, any adult walking onto campus is required to wear a mask. So that it's pretty clearly laid out in the guidance. I will put it in, maybe I'll put it into Antoinette's, underneath Antoinette's questions. So that, just to be clear, that is actually a requirement.
Thank you. And I think that both of those answer another one of the questions where it says, if my child finds a student not wearing a mask, then what will she do? And I think that they've answered that, to make sure that you follow those procedures and take it to the top, and definitely speak up if your student comes home and tells you that information. Will schools have a COVID-19 outreach team or response team for COVID-19 cases, for contact cases?
Some do, some might not, but that's why it's important to look at that plan and be well aware of it. And, you know, set up a meeting, ask the principal to have a town hall or a Zoom, or they social distance, whatever you feel comfortable, so they can kind of give you the highlight of the plan. Because I think that sometimes we as schools, we're like, well, just go look it up. It's on page 18. No, Mr. Scandor, you're going to provide us a 2 hours, 90-minute session on the highlights. And these are the major concerns. So yes, please reach out to and again, every district's going to implement it a little bit differently, right? Because the plan is one thing, but then it's the person implementing. And sometimes our people implementing need a little coaching and motivating and inspiration. So let's just make sure everyone's supervisors in and on board to make sure everyone's doing what they need to do.
Thank you. This is
Can I?
Absolutely.
Chime in, since we're talking so much vaccine talk. I think that when it comes down to, as an advocate and talking from the other side of the fence with some of the folks, especially in the Black community, that are not looking at the vaccination as the savior of our community, because we so often have not been in a situation where anyone cared to save us. I think a few things kind of make us pause on this kind of surgence of rushing to just get vaccinated. Every single time, I think a lot of our community hears, these doctors and other folks who are encouraging vaccinations. The alternative is just like vaccinate, or that's about it. There's never any conversation about our immune system and how we can keep that more healthy. There's never conversation about some of these folks who are in the communities that I serve that have food deserts, and how the fast foods that some of these people have to consume, because that's all there is to eat, creates diabetes and high blood pressure. There's like never been a concern or a rush to kind of create alternatives for these different things that continually plague the communities of the underserved. But this idea that we get this vaccination for COVID-19, it's almost as if we forgot about the other things that are killing us. And I think that when we talk about statistics, and the doctor was bringing up how many folks got vaccinated, why do we always gloss over the simple fact that with the COVID-19, there's been a 95% recovery rate for those who've caught it? Like, we don't even make any mention of that. It's almost as if this virus has become a death wish, and if we don't get vaccinated, you'll die. So though I understand the sense of urgency, I also have to come from another side and a different perspective, because it's often not even talked about or discussed, because everything has become get the vaccine, get the needle, you need to get vaccinated, you need to keep people safe. But you haven't cared not about the safety of people. When I drive into these communities and all I can see these kids going to get is McDonald's every day. All I can see these kids going to is to liquor stores that are considered to be grocery stores. I'm just, it's confusing to me when all we want to discuss is the vaccine, when there has not even been a discussion with the lack of healthcare providers in these communities that we're targeting, that we want to sit there and get vaccinated. So I often have to shrug my shoulders when we're so focused in this heightened focus on a vaccination, but have forgotten about all of the things that have kind of created some of the reasons why folks with their pre-existing conditions have to get vaccinated. So I would love to hear some insight on why are we so focused on um, a vaccine, and we've forgotten about all the other focuses on these communities, these cries for change, the poverty, the crime, all these things that have stricken these communities that have not made these kids be able to go to school in a proper way, because some kids are more worried about a meal and then going to school. Another reason why schools, it's great for schools to be open, because these are the meals that the kids can get provided, as well as looking at some of our facilities. We talk about janitors doing a better job in cleaning some of the facilities. I'm sure the janitors is probably saying, well, some of these facilities need to be totally remodeled. Where's the investment in that? So maybe we can prevent some of these diseases and these germs. So I'd love to hear your perspective on
Yeah,
that.
I definitely want to, I really hear you, because that is what I do for a living. I work here in South Los Angeles, and we are in the thick of understanding what will it take to achieve health equity in our communities, in our schools. That is why I fought so hard to get these vaccines to South LA. We wanted equal survivability, that of other zip codes, that of people of other skin colors. And we knew that COVID was killing Latin men 2 to 3 times as much as others. Black men were dying at much higher rates. And so those were definitely the impetus for why doctors like myself have really jumped in to do everything we can to make sure that people have access to their life-saving essential medicines, these vaccines that our taxpayer dollars have developed so that we can be protected. And you're right, these vaccines are only one tool, only one piece of the puzzle. And you're right, I talk about the gateway drug. This is a gateway drug. We must talk about primary care and mental health and prevention and violence prevention in our communities, about community policing standards, how we are not the enemy, we are the people that live in this community and make these communities work. So we've got to find better ways to address all of these issues, but we do know that these vaccines are one part of the strategy, and they're an important part, because disproportionately COVID did and has killed our community specifically. We have streets here in South LA where we saw 1 out of 4 in these very dense apartments and housing here in the housing developments, even the projects, where 1 out of 4 people died. And that was really hard for us to see. And that is why when we rolled out the vaccines and they weren't first to get it, that really bothered me and my brothers and sisters here in South LA. And that's why we definitely work very hard. But I definitely hear you, because it's not just enough to get vaccinated. Of course, we got to eat right and eat healthful foods, healthy. We've got to move and be active. Of course, we need to sleep well. We need to reduce our stress, and that stress is environmental stress. There are many contributors to all of that. But when we get COVID-19 infection, those things do not treat or stop us from getting put on a ventilator, put in the ICU, admitted to the hospital, having pneumonia, or dying. At that point, the vaccines are not going to work. These vaccines are your best bet at preventing, in addition to those things that we can do to have a robust immune response. It's not either or, but it truly is about bringing all of these strategies together. And it does not, you're right, it is not on deaf ears what you're talking about. Do not come in here and just, peddle these vaccines if you don't want to come here and address food insecurity, housing insecurity, the needs of our community. And so I do really believe and applaud you for bringing those up. But in addition to that, I really just say these vaccines have helped save a lot of people. There are 600,000 people in this country who are gone now from this earth because of this pandemic. It is real. It has killed disproportionately sicker and older people. Absolutely. I hear you. But just remember, we're not asking you just to get vaccinated for yourself. The risk is real that we could accidentally infect a sicker person, an older person, someone who may not be able to actually overcome COVID-19. And so for us to really be able to achieve that immunity, that community immunity, we all have to play our part. But I totally respect and understand where people are coming from. It is what we do here every day in South LA. We do not forget the Tuskegee trials. We do not forget the abuse of Henrietta Lacks cells, or the undertreatment of Black pain, or the medicalization of racism in this country. It is with and knowing all of that, that we still say this is not an experiment on us or our children. This is what it takes. This is our best shot at ending this pandemic so that we can do all those things we want to do, so that we can thrive, so that we can get back to life. And so we've got to get past this pandemic. That is true. And we cannot and we will not let people forget that they have forgotten about us, that we didn't get those resources. And we must build on this public health infrastructure, on revolutionizing the healthcare system, so people are not left out or left behind like they have been. We're not going to let them forget. It will only be criminal if we all forget. But know that I hear you. I really hope that we can help and have this conversation, and we continue. I know this is a dialogue, so I know it will continue well beyond this time that we have together on Zoom. But thank you so much for bringing up those issues. It is absolutely critical. Thank you.
And I concur with what you said. And that's, as me working on this awareness campaign, that is why we thought it's so important to have these panels that are talking specifically to these communities, to these Black and Brown communities, because we know that we're dealing with other issues that other communities aren't dealing with. And so I appreciate the dialogue. I appreciate everything that you're bringing up and everything that we're discussing, because we have to. I just want to touch on another question, which is sort of related when we're talking about medical problems, pre-existing medical problems. And one of the questions is, if your child has a medical problem that requires no mask or a vaccine, what should those parents do, or how is that being addressed?
I think maybe I can start out by answering that. So that's a situation that you would talk to your personal doctor about, the primary care physician, your pediatrician. Talk to them about situations if the child can't wear a mask or the child can't get vaccinated. That's a great conversation to have with your pediatrician and understand what the issues are. And then you can go and talk to the school. The school is supposed to be able to accommodate every student to have the least restrictive education that they can have. And there's we know that there are medical issues that might come up in those specific situations. So the guidance allows for that. I think I just put I put something in the chat actually just now about specific guidance around speech therapy. And I can also put the exemption stuff around medical conditions, the information there as well. And part of what I'm trying to do here in my answers in the chat is just give people access to resources that you can point to in the future in your conversation. So hopefully that's useful for folks.
Thank you. Catherine Beckham, you want your question addressed. I'm going to scroll back up and try to look for your question and try to address it. I just wanted to put that out there. There's another question that says, with a number like 12% of children needing hospitalization, why is there a huge push to have kids in-person learning? Why not wait 2 to 3 months until vaccine is available to under 12 age group?
That number, I think the 12% requiring hospitalization is actually, that's not the number that we're seeing for the state of California right now. So the hospitalizations in children is like single digits. The risk of a car accident in students is higher than a risk of the risk of dying in a car accident is higher than the risk of death in COVID in children. And that's related to, and so that's just like, we take that risk. We have our kids ride in vehicles, cars, buses all the time. We kind of accepted that. So the risk of hospitalization is actually very, 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 very low in COVID. It's very unusual in children.
Thank you.
Yeah.
Catherine, I found your question. I'm going to ask it now, and it's to you, Dr. Barda. It's been proven that the testing for COVID is far less accurate than we've been made to believe. FDA doesn't approve of it. Why should anyone get tested then?
So testing, that's a great question. And we've learned a lot about testing over time. They talk about 2 different potential issues with tests. One of which is you might miss the infection if a test can sometimes miss an infection, and a test can sometimes say that you have the infection without you actually having it. So the first thing is called a false negative, and the second thing a false positive. The false negative usually happens just if you've been exposed to COVID, but you haven't yet had enough virus in your body to make a big enough load for the test to see it. So it's usually within the first couple of days. So that's usually where the test is not going to turn positive, even if you might get sick a day or two later. So that's one piece. And then the false positive, where a test says that you do have it, but you actually don't, is pretty unusual. Actually, most of the tests that we have for COVID are actually very, 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 very good. Sometimes they can pick up like a little fragment, a little piece of the virus, even like weeks out. So those are the two things that we sort of think about in terms of testing. The tests that are being used in the school-based testing programs are all FDA authorized. The FDA has said, yeah, go ahead. There's a lot of paperwork, a lot of regulations around the schools being able to do that testing, precisely because the FDA has actually done that really important piece of oversight. So tests, I like to think of them as like, it's another layer. So the really important part about COVID in schools, we use a layered approach. Vaccines as a layer, masking as a layer, ventilation as a layer, hand hygiene as a layer, staying home when you're sick or symptomatic as a layer, and testing as a layer. So it's those things taken together that make a very effective, safe school environment. And so people use these tests in a very helpful way, sometimes just to do diagnosis. If you have symptoms, that's a way of understanding, do you have it or not? And sometimes people use tests in an ongoing way to kind of understand what's going on, who's sick in the school, let's help them stay home and not give it to other people.
Thank you. We had a comment from someone who says, are they going to talk about schools? It seems that we're mostly talking about COVID when as parents want to know about school plans. So to that comment, I want to say, please ask your direct question. Obviously, what we see here is that COVID is the main concern. And so most of these questions are tailoring itself to COVID-19. So if you have a specific question to school plans, please put it in the chat and we will be sure to answer it. Thank you so much for your comment. I see another one. Respectfully, my niece had diabetes and COVID killed her. I agree that people of color have been left behind forever and this needs to change, but COVID right now is an emergency. Be well, everyone. And I see that Dr. Abraham is typing a request to that, but I just wanted to read that and share that. Also, too, I see one, will classes be shorter schedule or alternate days in high school levels to increase social distancing?
So that's going to be a local decision, right? Because there's a number of questions, social distancing, shorter classes, what's going to happen on the bus. That will be all a local decision. That's why it's very important you get to those board meetings or you zoom in on those to see what's happening, because every school district is going to do it a little bit differently. Some may bring in cohorts of students, some may go 2 days a week, some go 3 days a week. So you want to be in the know. So if it's going to impact you, you're like, okay, what are the other options? Because this is not going to work for me. And there's a AB with the passage of AB 130. There is an independent studies component, but let's not let that be our last option, because I still and strongly believe I'm a high schooler, I'm a middle schooler. I want to go to school. I want to hang out with my buddies, even if I got to hang out 3-6 feet away, depending what the district says. But all those nuances of the school days, school times, how meals, how lunch, how that's going to be distributed, that's all local decisions. So please reach out to the principal. And again, do it via email, because sometimes there are some administrators out there that they don't check their voicemails. So when there's an email, they always check those. So thank you.
Thank you.
Kimberly, could I jump in and just speak to one of the questions about the urgency of getting back to school? I definitely hear the greater discussion about, you know, the concerns about the vaccines and all that. From the perspective of an educational equity advocate and activist and community organizer, I really look at the urgency for getting back to school as an equity, a racial equity and justice issue. because if we look at, I mean, what we do have some data around is that the learning loss, learning instructional time loss hits low income and communities of color disproportionately harder than it hits upper income communities. So if you imagine the trajectory, and like here in Fresno County, we have a mix of half our population living in a large urban center and half of it living in small rural communities that are far-flung and geographically dispersed and, quite frankly, economically depressed. You're talking about the folks out in the rural parts and low-income communities that may not have access to high-speed internet or may not have the bandwidth to, or maybe even the technical savvy to navigate those spaces. And so you're having just a huge proportion of those kids who are just not in instruction. Now, we know that there's already equity issues in normal school in the best of times. What we know is that during the pandemic, this has been exacerbated, many times over. So I guess from my point of view, and please, this is my perspective as an educational equity advocate and activist, is I want us to continue to decrease the opportunity gap between our students of color and low-income communities and low-income students and their more wealthy counterparts by making sure that they have access to high-quality instruction and instruction in schools in the most effective way.
Well, wouldn't that be about investment, right? Wouldn't that be reallocating monies into some more of the schools that are, getting funding compared to some of the other schools that lack the funding? I mean, wouldn't you think that? I mean, that's what I always look at. I mean, when I see things that are done in these communities, especially when being in the city of Sacramento, when they wanted to create the downtown area to be more of a vibrant and a tourist attraction, they invested in, they created the Golden One Center, and they made all these things around it that made people want to come back downtown when it was so dismal once before. So, I mean, to your point, in Fresno, brother, I can imagine what you guys are going through in Sacramento is just as bad, because I don't think that we're hearing the answers of what is going to take place for those who have been already behind, right, in these moments, and what kind of security and safety do they have? Because kids go back deficient in credits, and their ability to refocus, it's going to be a huge component, as well as with so much time. Some of our kids, as we talk about safety, I want to make sure that we present that idea that some of our kids aren't safe because of all of the rollicking and safe social media beefs and idle time that they've created. A lot of controversy and a lot of beefs that now they may have to deal with in school. So for safety for some of our kids, mentally, yes, but for some, it's going to be a very dangerous place because it was dangerous before. So I would love to hear, some parents or just some expertise on how are we going to combat that moving forward in some of these schools.
Mick, I'll hop in for 1 minute to speak to the funding piece. It's such an important piece to bring up. And the focus on the school funds, those $25 billion, are both on safety and on the mental and emotional pieces of schools. And that partly gets to the emotional safety and like that physical safety that has to do with interpersonal violence that you're talking about, people beating up on each other, having a beef, coming back into schools. The teachers are preparing for that and need to be thinking about that piece. And there's a real equity piece in general around that funding distribution for exactly the reasons you're talking about, Barry. So thank you for bringing it up, which is that we know those schools before the pandemic didn't sometimes have enough soap in their soap dispensers to have kids be able to wash their hand. That was Oakland Unified School District. And so there's an equity formulation that goes into that distribution of those $25 billion, where the schools that historically are underfunded and are also disproportionately impacted already in their communities by the pandemic get additional dollars and additional support. So it's such an important point, and it is something that there's at least structures in place to try and help address those really important issues. But maybe Manuel or somebody else from schools also can talk about those particular mental health pieces, because I know those are also a big active piece that people are working on.
I'm sorry, does anyone? Okay, perfect.
No. Yeah. So again, it's that board of trustees, right? They got this funding based on the student population size. They've had some meetings, and that's what, it's that old saying that if you're not at the table, you're what's on the menu. So it's not too late. If something is taking place, whether they need more security, or they need more counseling programs, or they need to bring in more groups like berries, right now is the time, right? We got to say the social, emotional, or whatever, every community is different. So whatever those needs are, that's equity. What do they need? Okay, let's get them what they need. Now, our elected officials, our board of trustees, again, we elect them, but again, we need to share with them, we need more of A, B, and C, so that way they could provide more of A, B, and C.
Thank you. We are at 7:24, and this is the panel's meant to go to 7:30. I want to try to get 2 more questions in. We'll try, but I definitely want to get this question in. Ventilation is said to be effective in restricting the spread of COVID. What is being done regarding ventilation in school classrooms apart from changing filters periodically?
So some school districts, I don't want to say all, I want to make sure Manuel didn't say all. Some school districts are bringing in these ventilating machines and they're putting them in the corner of the room. I was in a school district the other day in the cafeteria. They had 8 of them set up, and every classroom has this ventilation system. Now, which one is better than the other, I don't know. But again, that's a superintendent question, saying, who are we using? Why are we using them? Are they proven? Or is this, Manuel Escandon's air ventilation super fans? So make sure they're screening whoever they're using or the machines that they're using to clean the air.
I think that what we're really hearing is that parents, it's going to be really important that you're involved and ask these questions, because a lot of this is what we think is going to be most effective, but it's going to take parents being involved and asking these important questions and holding their school districts and holding their schools accountable. It's going to have to be a partnership between both. There is no perfect answer for any of these questions. I think the goal here, this is just that we want to get students back to in-person learning the safest way that we possibly see fit. And I think that that goes along with one of the comments here that I want to make sure I say before we end this, because I want to address it. It says, since you guys are demanding the children to get this vaccine, will you be demanding that students get the flu shot as well? If so, will you have to get both vaccines? Before someone addresses this, I just want to be clear, and Dr. Bardock can chime in here because I'm not the expert, but no one is demanding. We are encouraging. We are encouraging the safest possible environment for our students to return safely. So please, if you take anything away from here, there is not a demand. We know we cannot demand that. But I'm not the expert, so I'll give it back to Dr. Bardock, but I just want to make sure we said that.
Yeah, thank you so much. Yeah, and I have been listening to the conversation, and I appreciate all the nuances that are coming out of it. There is no demand, there's no mandate, there's no requirement. It's encouraging. We are all in this together. We're learning as fast as we can. Everybody's looking very carefully at the data because we want to make sure that we're balancing the risks and the benefits as much as we can. I think the reason we're encouraging so much is because we know that COVID can have real devastating effects, and we know that that the vaccinations can create a really protective layer for our communities. So that's where it's coming from. But yeah, no demands, no mandates. Thank you for highlighting that, Kimberly. And I'll emphasize that there's other safety layers that are also really important. Those masks are important, ventilation, engaging. I love Manuel's point about engaging with the schools. I think that's really, really key. So yeah. Thank you.
Right, and the other point I want to make sure we hit home is apparently there's this district out there that they got these vaccination vans driving around town. As a parent, I don't want my kid peer pressured. Hey, you get a ticket to the front of the line if you get vaccinated. That better stop. You know, you get down to that board, you email that superintendent right now saying there shouldn't be any minors vaccinated without parent permission. And I don't even want a parent permission in writing because kids will forge, right? Kids will forge signatures. So yeah, those vaccination vans, they better knock that off. We're not going peer pressure by vaccination. That doesn't work.
That sounds good, but we've already been peer pressured. I mean, look at the advertisement that goes with vaccinations. I mean, you have the shot over here in Sacramento in a rural, oppressed area, Mac Road, a vaccine shot at McDonald's. You have COVID, get the COVID shot, and you win $1 million. You get the COVID shot, you get to smoke, you get some marijuana. I mean, there's so many different things that is creating
free beer,
pressure. Yeah. Free beer. I mean, I could go on for days and days about what it is. So, I mean, yes, we're not saying or peer pressuring, but it does feel like that. I mean, I remember being in school, and yeah, they didn't force me to drink some alcohol, but they sure pressured me enough to drink some alcohol. It's just kind of like the advertisement and the direct channel that they want to try to propose to us about this vaccine, I think overlooks a lot of the obvious problems that we're going to have. I think that when we talk about funding, that's a huge thing. If billions of dollars are going to go to these schools that don't even use the millions of dollars that they have. So what can we do to access those dollars and to make sure there are equitable, credible organizations that are there emotionally for our kids, because we're the ones, the workers that have been there for our kids outside all the systems that had to shut down. Some of the grassroots organizations were still working, still keeping our kids afloat. I got 25 kids that I'm right now in a program, in a summer program, and employed for my Summer Nights of Impact program. 25 kids, and they don't just get employment, they get team building, they get youth development. They're in a youth development class right now. I mean, they get all these things because these kids were suffering. So how do we enact the monies to make sure that money is spread, not given to the top, to some superintendent or to some lifetime teacher that's on their way out? Like, that's what I would love to hear. How do we access the resources and spread them around so our parents don't have to be fighting, because they're going to have to fight when school opens back up?
So right now that system is to get to those board of trustee meetings to allocate those funds to the dollars you want. And I know it's easier said than done, but the current system is going to those board meetings saying, our district got X amount of millions. Can we invest X amount of millions or hundreds of thousands of dollars for these certain programs of equity that you all feel, again, that meets the needs of the local district and the students?
Thank you. This conversation could go on, and I just want to thank, this is our first panel. We're doing this in LA, we're doing this in Alameda County, we're doing this in San Bernardino as well. And if this is what it's going to be like, I'm very encouraged by the conversation, the transparency, the questions, and the openness of this. And so I'm putting this slide up because this is where parents can go, as Dr. Bardock showed earlier in her presentation, to find out more information and continue to be engaged, to continue to find answers to your questions, find out resources, find out where you can go and ask questions, as we continue to look forward to opening up the schools to in-person learning. There are things we don't know. We are figuring it out, but we just encourage for this conversation to continue. And so I want to thank Dr. Bardock. I want to thank Manuel, Dr. Abraham, Barry, and Mike for taking time out to have this conversation and answer to the best of their ability these questions. We know that there are still questions we weren't able to get to, and we apologize, but this was only an hour and a half. But hopefully this has sparked something in you, has shown you what channels you do have to get answered, what issues are out there that need to be addressed, and how we can try to support in-school learning. And again, we just want to say that we are not demanding vaccinations. We are encouraging vaccinations so that we can one day possibly see ourselves out of this pandemic. We know there are other ways, but vaccinations are key to getting us out of this situation. So I just want to thank you all for being a part of it. We're going to go ahead and close this out. And everyone have an awesome evening. On behalf of Safe
Thank
Schools
you,
for All,
everyone.
thank you.
Thank you. Thanks for everyone's questions and engagement. Thank you, Kimberly, for organizing. Thanks everyone for coming. Take care.